Hi, and welcome. My name is Dr. Jordan Miller, and I'm going to talk to you about the School of Technology for Public Health and our master's degrees in public health, the Master of Public Health with a concentration in public health technology, and the Master of Science in Public Health Technology. So I'm so glad you joined us to hear about these innovative programs. ASU is ranked #1 for innovation repeatedly in national rankings, and we've also been ranked #1 in sustainability and global impact. These are some people you might meet if you choose to join us here at the School of Technology for Public Health. The first is Dr. Mark Adams. He's our Assistant Dean of Education, and he formed the foundation of a lot of what you'll hear about in this presentation. My name is Dr. Jordan Miller. I'm a teaching professor in the School of Technology for Public Health. And then Dr. Dave Keating, Associate Professor, and Megan McDermott, our Graduate Support Coordinator, who you'll work with if you choose to apply. So the School of Technology for Public Health really is a radical new approach to public health. Our vision is to serve as a catalyst to build and deploy products, programs, and systems needed to sculpt the future of public health for this decade and beyond. We'll start by talking, though, about what is public health. Students come to us from a variety of backgrounds, whether their bachelor's degree is in biology or sociology, psychology, maybe even English. Most people come to graduate programs in public health from a different background, so I want to set the foundation for what we are and what we do as public health people. Public health is very broad, and you've probably heard of surveillance, which is where public health professionals like epidemiologists identify what diseases are active in a community or population. They look for the source of those diseases, and they look for methods to intervene, like you may have heard of contact tracing. They do monitoring and during outbreaks. And then we do disease prevention, vaccines, and things like behaviors like hand washing to prevent disease transmission. That's all part of public health. We also do research, environmental health, like climate health and preventing and responding to toxic spills, all part of public health. Health promotion, so encouraging exercise and healthy eating, public health. Emergency preparedness, communication is huge in public health right now. So it's really a very broad field. And the crux of it is we want to improve health for big groups of people, mostly through prevention. So a few definitions. Science and art of preventing disease, prolonging life, and promoting health through the organized efforts and informed choices of society, organizations, public and private communities, and individuals. That was a definition of public health from 1920. Next, the Institute of Medicine's definition in 1988. The fulfillment of society's interests in assuring conditions in which people can be healthy. And last, from 2017, what we can do together as a society to ensure the conditions in which everyone can be healthy. A few themes you'll notice that we're talking about what society does, what we do collectively as a group or as communities, and that we really want to create conditions for health. We're not just responding to illness. We are promoting health and creating health by the conditions in which people live. So one really important distinction in public health is the distinction between healthcare and public health. Everybody's familiar with healthcare, and healthcare is part of public health, but public health really is different. The healthcare industry treats people who are sick, while public health aims to prevent people from getting sick or injured in the first place. Public health also focuses on entire populations, while healthcare focuses on individual patients. It's important to understand. So what we're doing here is we're infusing technology into public health because we know that technology can help us improve our response to infectious disease outbreaks, to chronic diseases like diabetes and heart disease, and to other things like the conditions of living we were talking about, the impact of housing and food and transportation on health. Now, we have apps that do everything for us. We can order food, we can order rideshare by app. And we really have the opportunity at this stage to build apps that help promote health and create a healthier society. So I want to invite you to think of some ways you can see technology improving public health. This graphic shows some of the ways that public health operates. We do things like improving the quality of drinking water, making safer workplaces, safer motor vehicles. That includes safer highways and other things like seatbelts. We do vaccination, that one most people know. We also work to make food safer, whether keeping the food chain and supply chain healthy and safe, but also encouraging people to eat healthier, like more vegetables and fruits. We work on chronic disease, like I mentioned, whether through prevention, encouraging people to exercise and eat healthy, and also encouraging people to take medication if they're at risk or they've been diagnosed with a chronic disease. So I'll just sit quietly for a minute and invite you to think of some ways technology could be used to improve any of these goals. So a couple ideas I have or that I've seen in action during the COVID-19 pandemic, we absolutely saw technology improving our response. It was used to identify outbreaks, to create heat maps. If you've seen a map where there's red for lots of cases or high density, and then there's green for lighter density of infections or of cases. Those are called heat maps, and that's one technology infused approach to public health. People use apps for contact tracing. That's when we identify where there's been an infection and then look to see who that person has interacted with in other countries, not in the US, but people could sign up for an app that would automatically track where they had been and who might have been exposed if they were infected. Excuse me. People are developing apps to help people learn to take care of their bodies better. We know the boomers are aging and they have lots of musculoskeletal complaints. And so apps can help them take care of those concerns and treat their own physical therapy needs more effectively. There are apps that help people who are hungry connect with food, maybe excess produce from farmers for people who are food insecure. All kinds of ways apps have been and can be used, and other forms of technology can be used to promote health. So our degrees in public health technology allow you to be part of this transformation to help vision the future of public health and technology, to infuse those technological innovations into public health systems. The world is ready for this change, and we want to invite you to be part of that revolution. Public health is for dreamers, and we really want to mobilize you to build a healthier, more equitable world using the power of technology. So, what kind of careers are out there? What kind of job opportunities are there for graduates of our programs? These are some specific job titles that you might pursue. And then more in general, on the right side of this slide, some of the sort of fields in which public health people work, the areas in which they work: academia, government, industry. That can include, like I mentioned, building apps for health. They might work in corporate wellness, where people go into corporations and encourage them to offer healthier food options in the cafeteria, then market those options to employees, or implement exercise programs that can bring down the cost of health insurance packages and premiums. They might work for nonprofits, designing programs for the American Heart Association or Diabetes Association or Lung Association that go outreach into communities and teach people how to take on health behaviors or create, healthier policies to promote health, or a healthier environment, build more parks to allow people to exercise. We do all kinds of broad things in public health that really make it a very, very wide career field that you can tailor to your interests and your goals and really make it your own. So I'll talk a little bit in specific about our degree programs. We have two. One is the Master of Public Health with a concentration in public health technology. It's a 48 9-hour degree program that takes 2 years to complete. We are an in application status as an applicant for accreditation with the Council on Public Health Education, and we will be notified of our whether we will advance to accredited status in 2028. I think everything will go fine. I'm very optimistic. There are some advantages of graduating from an accredited program, and since we're in applicant status, our current graduates will be able to say that they have graduated from an accredited program, assuming that our application is successful and we become accredited. So some of those advantages are working in like CDC fellowships. There are certain kinds of fellowships and job opportunities that require their applicants or candidates to have graduated from an accredited Master of Public Health program. And if you want to pursue a PhD program from an accredited public health program, you would need to have graduated from an MPH program that is accredited. So those are a couple of the advantages. I really would describe it as if you anticipate a long-term career in public health, the MPH program has advantages for you. If you are more wanting a taste of public health and you want to explore a career in public health, but you would like a sort of a quicker pathway to a master's degree, we have a Master of Science that is a 30 credit hour and 1 year program that might be the right fit for you. And this program really can be a great gap year fit for medical school or other doctoral programs. I will say we have in both of our programs, we do have gap year medical school applicants. So I think they both can be attractive for different reasons. But the Master of Science really is a very quick program that we sometimes describe as like an MPH Lite that allows you a quicker pathway to transition into public health. So the specific curricula are here. This is the Master of Public Health MPH. It is available both in immersion, in person, and online. This is rooted in the core competencies of a traditional MPH program. This is the coursework. Foundations is very public health core focus, the two foundations courses. One Health is an exploration of the interactions between human, animal, and environmental health. Biostatistics and epidemiology, really essential public health skills that allow our graduates to work in some sort of advanced analytical roles in public health. And then our public health tech concentration courses, public health technologies, and exploration of the wide range of public health technologies that are already available. Systems design and engineering, health technology and equity. Equity really is essential to public health. AI and machine learning, where there's so much more that's being done to develop interventions and responses in public health through AI and machine learning. Health communication, behavior, and technology, looking at health communication, which is, sort of obviously important if you've been on social media. Health communication is everywhere, and we are really invested in responding to misinformation, disinformation, and cleaning up and improving the public health communication space. Public health technology, ethics, policy, and law, ethics being essential to public health practice. So you can see really a nice core set of public health focus courses with a really strong infusion of technology. After the first year, our MPH students complete a practicum, which is very similar to an internship. They work in an organization practicing public health. This allows them to network. It prepares them for self-marketing when they graduate, gives them some really important skills. And really, I should say, all of our courses are designed to prepare you for graduation. They're application-based. Our graduates will move out into the world with a portfolio of their accomplishments. Students in the entrepreneurship course pitch public health technology innovation and other tangible work products that our students create, so that when they're approaching potential employers when they graduate, they can say, I've done this, I've done that, and show those work products for professional self-marketing. We want you to graduate and hit the ground running on day one, and that's true for both of our programs. But the practicum really is the most experiential of all the courses. And like I said, similar to a traditional internship. We've developed the Public Health Technology Core, which is a network of partner organizations who will support our students here in the Phoenix Valley if you're in Arizona. If you live outside of Arizona and you plan to attend online, we work with organizations near you to establish a partnership to support your practicum so that you can gain that real world experience that will prepare you to hit the ground running when you graduate. For the MS, the 30 credit 1 year program, the coursework is somewhat similar, but the epidemiology and biostats are replaced with more data science courses. This enables a slightly different skill set, and these students are prepared for very industry-focused jobs when they graduate, like I mentioned, working with tech companies potentially to develop health-focused interventions and solutions, as well as potentially nonprofits, governmental organizations. We really want to create a flexible graduate who is infused with skills from a variety of disciplines. This is a dynamic field, and we're teaching from communication science, law and ethical science, data science, and public health to create a very adaptable, dynamic skill set for our graduates. And again, this is great for a gap year program. It's only 1 year and it positions you for med school or other sort of clinical doctoral programs like an OT very well. So instead of a practicum, the MS students complete an applied project. This is tailored to their interests. They work with a faculty member to develop a real world solution using technology and public health. So far, our students have tended to focus on communications products, whether a communication outreach campaign or maybe developing an app for health-related concern. For example, I worked with a student who developed an app to help people identify women's health resources in their area. So they used mapping and app development with health-related knowledge to support a public health challenge and response. There are really a lot of ways you could approach this, and we support students in identifying a project plan that is very aligned to their own interests and career goals. It's tailored to you. So, how to apply? The requirements are the same for both. We're looking for a 3.0. However, there's some flexibility there. We're looking most closely at the last 2 years of an undergraduate degree or the full scope of a master's degree if you already have another master's degree. If your GPA isn't quite there, we also look at your work experience. Maybe there were some sort of limiting life factors that happened during your bachelor's degree that compromised your GPA. Tell us your story. We're looking at the whole person to see, do we think you would be successful in our programs? Do we think you would have a positive impact on public health? Those are the kinds of students we want in our program. And so I encourage you to apply, even if you are a little bit concerned you might not be strong in every area. We ask for official transcripts, a personal statement, 1 to 2 pages telling us about your interests and your future career plans, 3 letters of recommendations from academic and professional sources, a resume or a CV, which is curriculum vitae, proof of English proficiency for international students. GRE scores are not required or requested. Now, the really big news is we have scholarships available that's up to $16,000 for MPH students, up to $8,000 for the first year for the MS students. The reason that's different is the MPH is a 2-year program and the MS is a 1-year program. We don't know if the scholarships will be continued year to year. They might be. So this $16,000 is for your first year and the $8,000 for the 1 year of the MS program. These are huge. This is very rare to have these kinds of scholarships available, and I'm really excited to be able to tell you about it and that we can offer them to you. So they're GPA based, and connect with us. I'll give you the contact information in a minute. Connect with us to find out more about what you might qualify for. Other sources are loans that we are a STEM program. We're designated for the STEM OPT. So this is for international students, different funding amounts and pathways are available in different countries. So check out what's available in your home country. Sometimes the government will offer funding, sometimes employers. It really varies by location. So I can't really offer too many specifics, but we are designated as STEM, and it can be, a really great funding package for some students. So check into what's available for you in the STEM OPT option. Our application portal is open for both programs, and we're currently accepting and reviewing applications all the time. All application materials must be received by August 2nd for international students. Really, we would like you to apply ASAP so we can help support you in getting a visa and getting all set up. So next steps, if you'd like to apply for the MPH program, you're going to apply through SOFAS. It's the central application portal for all accredited public health programs. You'll go to SOFAS and then they will pass your application along to us. And I will show you the link to get to the SOFAS webpage in just a second. Here it is. So on the right is the dark blue QR code is for SOFAS. And I'm going to encourage you to just pull out your phone, take a picture of it, pull up the webpage now so you have it for later. On the left is our ASU webpage for the MPH program. If you have questions about the program, you want to get a hold of us directly, this page has those links and that information. So I like to just have these things, on my phone. I keep a lot of tabs open, so I'll encourage you just pull it up now, keep the tab open, and maybe you want to look into it later. You'll have it available if and when you need it. All right, and again, this is the MPH program, 49 credit hours, applicant status for accreditation. Really great for people who anticipate a long-term career in public health, who want to be eligible for federal fellowships in like federal public health, CDC, those kinds of fellowships, as well as doctoral programs in public health, accredited PhD programs in public health. You'll want to graduate from a Master of Public Health program. If you're looking for something a little bit more flexible, 1 year, 30 credit, Master of Science in Public Health Technology, this is the place to go either for more information or to apply. Grab this QR code. It'll take you to our ASU web landing page for the MS in Public Health Technology. Really great option for students from a variety of backgrounds. Both programs really welcome and are designed to support students from a variety of backgrounds. So if you don't feel like you're particularly a tech person, you don't feel like you're particularly a data scientist, that is okay. We plan to teach you. We do not expect you to come in with this skill set already. We work with everybody, all kinds of students, and we want to support you to succeed and to learn these skills. We don't expect you to come having them pre-equipped. So ASU offers some workshops to help you prepare your application. Give you a minute if you want to grab this QR code. They host live sessions by Zoom on all different times and on a variety of days. They'll help you with tips for your application to strengthen them, how to ask for letters of reference, how to get your transcripts, all kinds of things. They can answer questions about what being a student at ASU in person is like. So check it out if you'd like support for preparing your application. I'm going to skip by these FAQs just because I would like to tell you how to reach out to us directly. The first link here, schedule an admissions meeting, will take you to Megan McDermott, who you saw in that first slide. You can tell she's a nice person and very helpful, and she can help get you all set up, answer specific questions about whether your GPA is going to be competitive, how to, ask for letters of recommendation, get your transcripts, all that kind of stuff that's specific to you. She's a really great person. So I encourage you to grab that link. You can schedule a meeting with her with this link and just get right on her calendar and she'll meet with you to discuss. The second QR code, if you'd like to submit your FAFSA, that will help you get set up with student loans. And or even if you don't want student loans, it can qualify you to be, apply for certain scholarships and things. So we encourage you to submit a FAFSA if you are a US-based student. If you'd like to schedule a campus visit, that link is on the right. And that is everything I have for you. If you'd like to reach out to me, go to the QR code I showed you for the MPH program landing page, and you can get a hold of me that way. I'm happy to answer questions. I think we all are. We really are. Everybody here at the School of Technology for Public Health is excited about these programs, and we really want to talk to you. If you're interested and you want to help us shape the future world of technology for public health, we really want to talk to you, want to welcome you to join us in helping build that future. So thanks so much for joining me for this presentation, and I hope to hear from you soon.